Meeting is recording. Perfect. So without any additional delay, I'll go ahead and start us off. Good afternoon, everyone, and thank you for joining us for today's webinar, The Impact of Trauma on Children and Families, What Law Enforcement Professionals Should Know and Be Able to Do. This webinar is brought to you by the International Association of Chiefs of Police. My name is William Moore, and I am with the Office of Juvenile Justice and Delinquency Prevention's National Training and Technical Assistance, or NTAC. As your technical host, I would like to take a couple of minutes to discuss a few features of the Adobe Connect webinar platform and provide a few announcements to keep in mind. Please note that this event is being recorded and will be published on NTAC's YouTube page. The webinar recording will be archived on NTAC's YouTube page, where you can also view past webinars. For the event transcript and supporting materials, please contact the OJDP TTA Help Desk. For those wishing to download a copy of the PowerPoint slides and other important documents, you may do so by locating the Handouts pod directly above the chat area. Here, you will also find an FAQ for webinar participants that will likely address any technical related questions. Click on the file name and then click the download button. During today's webinar, presenters will address questions during our Q&A segment of the webinar. Please type your questions into the chat box as they arise. For those of you participating in this webinar as a group, please take a minute to help us count. Go to the chat window and type in the total number of additional people in the room with you today. If you are viewing alone, there is no need to type anything into the chat pod at this time. And I'll give folks just a couple of seconds to do that. Again, please type in the total number of additional people with you in the room today. If you are viewing alone, there is no need to type anything at this time. Following today's webinar, attendees will be sent a certificate of attendance. This certificate is sent approximately 1 hour following the conclusion of the event and is sent via an Adobe Connect thank you email. Please keep an eye out for your certificate in your email. Please note that only participants that are registered and signed in will receive a certificate of attendance. At the conclusion of this webinar, you will be provided with a link to a brief evaluation about today's presentation. The feedback you provide is used to assist in future planning and training. I will now turn today's webinar over to our moderator, Tiffany Garner, for today's webinar. Thank you.
All right. Well, good afternoon, everybody. On behalf of the International Association of Chiefs of Police, or the IACP, in collaboration with the United States Department of Justice, the Office of Juvenile Justice and Delinquency Prevention, and Yale Child Studies Center, welcome to today's webinar entitled The Impact of Trauma on Children and Families, What Law Enforcement Professionals Should Know and Be Able to Do. Before we get started today, I would like to introduce our presenters for you today. We have Kristin Hamel, who's the clinical coordinator at the Childhood Violent Trauma Center at Yale. We also have Catherine Giuseppe, who is our postdoctoral fellow at the she's a postdoctoral child trauma fellow at the Childhood Violent Trauma Center, as well as our last presenter will be Lieutenant Rene Dominguez from the New Haven Police Department. I will share a little about their bios. So first, I'll start with Kristin Hamel. She is the clinical coordinator, as I stated before, at the Childhood Violent Trauma Center. Ms. Hamel works closely with the New Haven Department of Police Services to implement the Child Development Community Policing Program, which is an innovative law enforcement mental health partnership that has been in operation for more than 25 years. She has extensive experience providing joint responses with the law enforcement to children exposed to violence in the community settings, as well as trauma assessment and trauma-focused mental health treatment. Ms. Hamel has developed and provided training for and co-facilitated numerous trainings with law enforcement partners. She received her Master's of Social Work from the New York University and holds an undergraduate bachelor's degree from the University of Connecticut with a concentration in psychology and criminal justice. Our next presenter will be Catherine, also known by Katie Jessapone. That's I got to write this down. She's a postdoctoral child trauma fellow and is currently a clinician at the Yale Child Study Center, which houses a childhood violent trauma center. And she also works with the Child Development Community Policing Program. Katie's clinical interests include trauma-focused treatment with children and families, mental health emergency response, and community collaboration. She has extensive experience providing joint responses with law enforcement to children exposed to violence in community settings and is a trainer in the trauma-informed policing strategies. Broadly, Katie's research interests consider mechanisms explaining relations between parenting and childhood internalizing problems, varying factors related to parent-child attachment in the childhood and adolescence, with particular emphasis on children who have experienced early adversity and how such findings can influence intervention. So we're glad to have her. And last but not least, we have Lieutenant Rene Dominguez, who is a lieutenant with the New Haven Police Department. Following her graduation from Bridgeport Police Academy, she joined the Newtown Police Department in 2000, where she served for 2 years. She transferred to the New Haven Police Department in 2002, where she served first as a patrol officer and then as a district manager. As a district manager, Lieutenant Dominguez acted as a liaison to the community, organizing community functions within her district and resolving issues that arose throughout the community. Lieutenant Dominguez is a leader in the New Haven Child Development Community Policing Program and has also served as a consultant to the International Association of Chiefs of Police, collaborating with the Yale Child Study Center to develop the Toolkit to enhance law enforcement to respond to children exposed to violence. So glad to have you ladies with us today. So I will now turn it over to presenter Kristin Hamel, to Lieutenant Rene Dominguez to begin our presentation. My internet died.
All right, good afternoon, everybody. So the objectives for today, we're going to differentiate between exposure to violence and trauma, describe what traumatic reactions look like on scene, and then select trauma-informed policing strategies to respond to children and families on scene in order to support and enhance recovery. So we're going to set the scene for you with 3 examples, but it's going to be some things that you guys are going to see in your everyday interactions with the community, and just how we can use this curriculum to insert it into your everyday work. Our first example is officers respond to a report of domestic violence during which the mother of 4 children aged 8 months, 3, 11, and also 11 was in a heated verbal argument with their father of their children. The father threatened to kill her. While the mother was attempting to call 911, the father took the phone and left. Our second example is a narcotics raid. Police received information that crack cocaine was being stored at the family home where 3 children aged 2, 7, and 14 reside. Officers located 30 grams of crack cocaine, 50 grams of heroin, as well as drug packaging, and children were present on scene. And then our final one, 4 shots fired into a car in front of 2 residents. One residence was struck with 1 bullet, however, the bullet did not penetrate the outer wall. 2 families and 3 children, 2 16-year-olds and a 6-year-old were present. And just keep in mind these scenarios because we're going to kind of refer back to them later and discuss how we could use everything that we've learned today with one of these specific examples. All right, so what do we mean by exposed to violence? When someone is exposed to violence, it's not just the victims and the witnesses, it's the child or someone hearing it, seeing it, hearing about it, or seeing the aftermath of an incident. And violence is an event, but traumatic dysregulation is the potential reaction to the event. So not every traumatic event, not every event is going to be traumatic. Not every violent event is going to be traumatic for a child.
Right. So those cases that Lieutenant Dominguez mentioned, those 3 cases, those are events, and then we'll talk about what possible reactions could be following those.
Okay.
I'm going to jump in and talk about what we mean when we talk about trauma. So trauma results when an individual is exposed to an event that overwhelms their ability to cope. What's most important is that it's an individual's response to an event or series of events that causes the experience of trauma. Psychological trauma is an injury, very much like physical trauma. And the way people experience an injury depends on who they are individually and their individual characteristics. So an example might be that when someone twists their ankle and it swells up, that might be normal, whereas then if that continues for several days, they might want to seek medical attention. Yeah. So traumatic reactions can look different from person to person and manifest very differently in different people. Trauma creates a sense of chaos, loss of control, feeling helpless. It also results in changes in our brain functioning, whereas our organizational capacities or thinking part of our brain actually goes offline. It also causes physical and emotional reactions as well as changes in our thinking and feelings. And now we want to do a brainstorm all together, since you all know very well when you're responding to different scenes out on the job, what some of these reactions might look like on scene. So there's 4 different categories we want to think about, and we're going to start with physical reactions. So what might be some physical reactions that you might see on a scene? William, can you pull up the first poll for us? So if everyone can just brainstorm and think, oh, great, I see some coming in. Some great examples. I see people saying that crying might be a reaction, vomiting, sweating, feeling in shock, looking in shock.
Catatonic.
Unable to move, exactly, immobilization. Some other ones might be, muscle tension, shortness of breath, being physically stuck. All of those are excellent, good points. So, William, let's move on to the next one, which is going to be behavioral traumatic reactions. So let's do it again. We'll brainstorm and just throw out some reactions that you think might be typical behavioral reactions you might see on scene. Think about particularly the scenes that Lieutenant Dominguez threw out there initially. So yelling, I see again, crying.
Shut down,
Scared.
lashing against someone, confused.
Joking. Yep, these are all really good ones as well. We can think about someone looking very irritable or agitated, actually being very slow or inactive, irritable, having angry outbursts and yelling. Those are all excellent reactions as well. All right, let's go on to our next one, which is going to be the cognitive or brain functioning traumatic reaction. You can pull up that poll, William. And again, let's go ahead and jump in. Great, I see them coming in. Forgetfulness, inability to remember, depression, confusion.
Yes. Not being able to answer simple questions.
Not being able to focus or concentrate. These are all right on. So some of those, again, when our brain starts to sort of go offline and not be able to function as it typically would, there's definitely confusion. We can't really reason properly. Definitely some difficulties in memory and attention. So those are all right on. Let's go into our final category, which is going to be emotional traumatic reactions. So again, let's do one final brainstorm about what some of those emotional reactions might look like on scene. Fear, crying, sadness, laughing, anger, denial. Those are all great as well. And those emotional reactions might very much range and sort of be all over the map. So 1 minute someone might be very angry, it might shift to crying, upset, feeling very stuck, or have that sort of lack of emotion that's coming up and look like they're just staring off and stuck. Sudden fits of laughter inappropriately might come in, but all really great examples. Exactly what we would expect. Yeah. All right, we're going to stop the poll from there and go on to the next slide. Okay. Go through here. We covered those. All right, so without recognition, support, and treatment, early traumatic reactions can actually persist and result in long-term outcomes, including a variety of emotional, behavioral, social, and psychiatric consequences. But most importantly, recovery is possible. It starts with recognition and social support, which police officers actually have the unique opportunity to do so by being first responders. If you look at this slide and think about many of the things that you see on here is the root of police calls for service, and you'll be very familiar with them. For example, we list at the top attachment and relationship problems that might be related to domestic violence, or if you think about substance abuse and criminal behavior, all of these things you see on scene all the time, every day. So by recognizing and intervening early, this can actually help more kids recover from traumatic experiences and lead to less police calls in the future. You'll see outlined on this slide the factors that help children get through the difficult experiences in their life with or without fear or negative consequences. Most important really is family and social support. Without recognition, however, they might not get this support. To recognize some of those traumatic reactions we had outlined and reestablishing safety and security, and also some of the order that you can do on scene is one of the critical functions in officer compliance.
All right, so we're going to take all of this and just to show you how officers are protective factors. So an officer arriving on scene is able to reestablish order and safety through calm, authoritative, purposeful presence and action. A lot of times just arriving in just your uniform calms things down. Assessing ongoing threats to safety and order and develop plans to address those threats. It's very calming for someone who's unable to think, for you to be able to kind of just exactly tell them what the next steps are, exactly what's going to happen, so that they don't have to be thinking about all those other things. And then identifying those children and family members who are showing signs of distress in order to help them regain control. Additionally, providing information about traumatic stress reactions that caregivers can be watchful for in their children and themselves. And we're going to go over in depth more exactly what you may see, and identifying immediate resources that may increase a sense of safety, security, support, and control. And this may be a local shelter or just a victim's advocate for them to reach out to, the SRO in the school, any sort of additional resources.
So there's 4 phases of traumatic reactions. There's the immediate or acute reactions, which has been from right after the event occurs until about 24 to 48 hours. There's the peritraumatic phase, which is up to about 3 months after the event occurs. There's when chronic PTSD and related disorders set in, which starts at 3 months after the event. And then there's delayed onset, which is 6 months or later after the event. And so today we're going to focus on the first 2 phases. There are opportunities during these phases for officers as first responders to interrupt the process that leads to PTSD and other longer-term disorders. Officers are uniquely equipped to play a critical role in the lives of children and families following violence exposure, but before those longer-term consequences that we just discussed become a reality. So now we're going to talk a little bit about some of the strategies, a toolkit that we've developed to help officers enhance their responses to children and families exposed to violence. The development of the toolkit was a collaborative effort of Yale and the International Association of Chiefs of Police, joined by the New Haven Police Department, the Charlotte and Mecklenburg Police Department, and the Mecklenburg County Mental Health Services. The development of this toolkit was funded by the Department of Justice and the Office of Juvenile Justice and Delinquency Prevention. These tools were developed on based on strategies and approaches that the Yale Child Study Center and the New Haven Police Department have been utilizing for more than 25 years with the goal of equipping law enforcement professionals in their vital roles, helping children and families exposed to violence through identification and trauma-informed response. So these tools were designed to have the greatest utility in the field, particularly for law enforcement agencies that may be working without a mental health partner. So there's 4 tool types that are included in the toolkit, and today we're really going to be talking about the operational protocols and the operational tools. So the operational protocols that are included are the on-scene acute protocol for children exposed to violence. This is really focused on what officers can do when they arrive on scene to a call. The protocol for responding to the needs of children at scenes of DV, which is similar but specifically for domestic violence cases, and the principles and practices of death notification to children. So this is what these protocols are for agencies that are interested in enhancing its response. They're what agencies that are interested in enhancing their response to violence could adopt. But they also have utility for individual officers, offering specific tips, guidance, and considerations for approaching and interacting with children and supporting potentially traumatized caregivers. And so the tools that are in the toolkit, there are reactions that police may observe from children and youth, what traumatic stress reactions may look like on scene, which is a more enhanced version of what we just did with you guys when we talked about the different physical reactions and cognitive reactions, effective police responses to traumatic stress in children of different ages. This is broken up into different stages of development and walks through what is typical for each stage, what common responses to children exposed to violence for that stage, and what officers can do on scene. Commonly asked questions from children and example police responses. These are the questions that kids commonly want to know when you respond on scene, like why are you here? What's going to happen to my mom and dad? What to do when your child is exposed to violence. This is a brochure that is really helpful to give to caregivers, which walks them through what symptoms to look for and what they can do to best support their child. Let's see, I missed common issues with caregivers and police responses. So those are issues that frequently come up and with caregivers and how officers can respond in those situations to assist caregivers to best support their children, such as when a caregiver is minimizing what just occurred. And then there's teaching the tactical breathing technique, so teaching calm breathing to children and parents.
And just in real-life application, so what to do when your child is exposed to violence brochure, we at the New Haven Police Department, we use that at least every single week, handing these out to victims that we come in contact with as officers. So this is something that without a mental health partner, the officers are really able to give the parent or the caregiver something to be able to, when we leave and everything kind of settles, to have something to look back at.
So now I'm just going to show you a couple. These are they're screenshots to show you what the tools actually look like. So if you were to download them, it shows kind of the level of detail and information that's available both to agencies and to frontline officers. So this is the on-scene acute protocol that I referenced. There's the questions commonly asked. And the common issues for caregivers and police.
So when police officers are better equipped, they're able to create a safer environment for the children to reestablish a sense of safety and security. And that's really what we do and you do on a daily basis in all the calls that you go to. Officers are able to play an important role in helping the child and family begin to heal and to thrive. And the foundation of trust between the police, youth, families, and the community begins to be developed. Officers also feel more effective and satisfied in their work, and you don't leave the scene feeling like, oh, we're just going to be back here again, or there was nothing that I could do, all is lost. So it kind of gives you a little bit more ability to feel like you have, that you're more effective. So what we want to do now is we're going to bring up our next poll. I want you to vote on the 3 cases that we talked about in the beginning, and I can give you them one more time. So case 1 example was the domestic violence incident. The second example was the narcotics raid, and then the third case example was the shots fired. So we would like you to vote, and whoever gets the most votes, we're going to kind of discuss how we would take these protocols into that specific example. William, if you can go, thank you.
And just as a reminder to the audience, the little circle that is right next to your selection, just simply click on that to cast your vote. All right, give folks about maybe 15 more seconds to cast their vote. Remember, just select the little circle right next to your selection. Okay, ending poll now.
All right, so it looks like we have domestic violence as our most chosen. Right, so which is definitely something that we probably see the most of. So we can go back to, there we go. All right, so we're just going to recap the scene, and then Katie's going to start us off. So the officers responded to the report of domestic violence, during which the mother and her 4 children, 2 11-year-olds, an 8-month-old, and a 3-year-old, in a heated verbal argument with the father. Mom tries to, dad threatens mom, threatens to kill her, and then while mom's trying to call 911, he snatches the phone away, and he leaves, and then the police arrive.
I'd really like to go back to, if we can pull up the slide that shows the general things that I think that would go across all 4 examples. I don't have this, but which slide?
Which slide?
The slide that lists in terms of the 4 responses that are there. This one? So I wanted to highlight this again because I think it's very important that while we're going to focus on the domestic violence case, that these 4 things in particular can really be done across the board for all the case examples that we've provided. So officers can create a safe environment, reestablish a sense of security. They can play an important role in helping the child and family begin to heal. A foundation of trust between the police, youth, and families and the community is developed, and officers feel more effective and satisfied in that work. So those, I think, are blanket across all scenarios.
So for domestic violence, a lot of times we forget about the baby, like that. If that was the only child on scene, we might see officers saying, "Oh, well, the child can't talk, the child isn't affected." These are times where you're going to make sure that you're making a point to the caregiver that the child may have, may sleep more, may sleep less, may be more clingy, may not want any, be very aloof to the parent, may want to eat more, may want to eat less. So all of these reactions that are based on the basic needs may change in an 8-month-old who is exhibiting some sort of responses to trauma. For the 11-year-olds, we want to be careful when you walk into a scene like this and the parent is saying, oh, they're upstairs watching TV, and you walk into the room and the child is playing video games or the child is just watching TV. That is something, they're not used to it. It's not something they didn't hear it, oh, it's not bothering them. Those are the children that may be affected even more so because it might be something that is going on chronically in their lives, and this is their coping mechanism, but they're not dealing with it. And don't discount these children. Make sure that you're addressing them and engaging with them and seeing how they are also doing.
I think it's also really important not to negate that the caregiver themselves might be having reactions, and that would be expected. And I think it's, even in all that we're saying, that the varying ages of children and where they are in development and how the differences will look according to their age, that it's important to also not neglect the fact that an adult and caregiver within this scenario is having reactions not only for themselves, but also in response to their child.
And then also in domestics, you're going to know as the officer on scene, like, what are the next steps? Is someone to get arrested? Is someone going to the hospital? Those kind of questions prepare for each age group. So obviously the 8-month-old, we're not going to be explaining anything, but how you're going to explain this to a 3-year-old and how you're going to explain it to the 11-year-old is going to be a little bit different. So you want to use as plain language and as simple terms as you can, but we're going to be truthful to the age-appropriate mentality and cognitive ability of the children. Do you want to go ahead?
So, we talked about briefly those 4 stages. And so when police are arriving on scene to this domestic violence, that's that immediate stage. And we talked about protective factors. So the officer, reestablishing safety and order, the officer arriving in the uniform, using a calm, authoritative voice, and calming the scene is the first protective factor that occurs that can help really start that process of mitigating those long-term effects. And then just recognizing that, Lieutenant Dominguez was talking about all the different kids that are on scene, just recognizing that there are kids on scene and that all of them may be impacted regardless of their age. That's the second protective factor. And, helping, Katie mentioned the caregivers, and helping the caregiver to calm down and pay attention to their kids, that is really helpful to the child as well. I lost my train of thought.
Okay, and the only other thing I would say about which could be used in dealing with the situation, in all the situations, is what's going to happen next for the child. Like, that's super important. They want to know, even though they want to know, is mommy or daddy getting arrested? Is someone going to the hospital? What's going to happen to me? Mm-hmm. Where am I going to go? So developing some sort of plan for the child. Okay, I'm going to help you pack a bag. Make sure you have, your favorite stuffed animals. Let's get some pajamas and some clothes for tomorrow because you want to, yes, you're going to go to school tomorrow, but maybe no, you're not going to go to school tomorrow. Have these prepare some of the questions that the child might ask that you'll be able to definitively tell them. It just helps going back to restoring the order, and you kind of being the person that in the middle of the chaos that's able to take control and say, this is what we're going to do, and it really helps to calm the child down to know what the plan is, who's taking care of them, and that tomorrow things are going to proceed as normal, or that they're not, but at least they're aware.
No, it can also be helpful, for the officer to understand and appreciate that the reactions that they're seeing on scene may likely be traumatic stress reactions. So that caregiver who's yelling, who's irritable, who is, trying to ask questions and they're stuck on the same piece of what just occurred, that those are actually traumatic stress reactions. And being able to recognize that can affect how you interact with them, which can both help you as an officer, but also help that family. What were you going to say, Katie? I was just going to highlight that what Lieutenant Dominguez was pointing out is not only is that sort of helping to organize and restore security, but it's also highlighting that kids, when they think about themselves and what's going to happen next, their concrete needs about, their day-to-day, when am I going to sleep? Am I going to have pajamas? That their concrete needs that they have and basic needs on a day-to-day basis. In those moments of chaos that are easy to forget, and that's often what their head is going to very quickly.
I think that at this point we're going to open it up to some questions. Tiffany, is that what's going to go next? We can't hear you.
Yes, let's try that again. Thank you. Thank you, ladies, so much for sharing the information so far, and hopefully you all out there this has been helpful to you and some of the work that you're doing. I do want to make a note that for those of you all who have expressed interest in wanting to obtain a copy of the CV Toolkit. You can download it in the handout box, but also if you would like for us to mail you a copy, we will need your address as well. There's been a couple people that have expressed interest, so we just want to put that out there. Please place your mailing address in the box as well if you're interested, or you can just download it, either one. All right, so now we're going to take some questions from you all, and so feel free to type those into your chat box, and so we'll get to as many as we can as time permits us to. So I do want to first address the question about where can we obtain the effective police responses to traumatic stress question. And it was a question about, are the operational tools all available in the toolkit? And so we will let you guys know, yes, all the tools are available in the toolkit. So for those of you all out there who may have been wondering as well, so those will be in there. Okay, so let's get to question here. And Lieutenant Dominguez, this question is going to be for you. How many officers would arrive to the scene? Someone has stated that this is amazing but hard to do when you are securing the scene. So I'll let you answer that question there.
So in our police department, for domestic, 2 officers would be dispatched. So I think it's probably going to be the same across the board for the most part in the domestic, where minimum you're getting 2 officers. This is obviously after officer safety is number 1. You're going to do what you have to do to stay safe. You're going to secure the scene, any medical that needs to be rendered, calling an ambulance, putting somebody in custody. All of that is going to be done first. This is what then happens kind of like next, to be able to take a step back, take a deep breath, slow the scene down, and you guys deal with these kids all the time anyway. You are already addressing children. You're already doing so many of these things, but we just want to make it a little bit more aware of that you're doing it, realizing that there are children here, and what can you just take some extra steps to be able to make as much of an impact you can on a child following a traumatic event, because you don't know, what that small thing might mean to that child. It might be huge.
Okay. All right, thank you. And our next question, so perhaps Kristin or Katie, if you want to address this question here about how does this apply in a school setting or to SROs?
I'll take that one as well.
You want to take that one too? Okay.
Unless you.
No, you can take it.
Okay. So in a school setting, there's obviously some additional challenges because the administration is sometimes our first point of contact, and depending on what the call is in the school, we might have to get the parents there first. But I think you could still use some of these tools, especially with kind of recognizing a child's reaction. So say if it's a fight in a school, so being able to separate the kids, and then while you're waiting for the parents to arrive, and you're not asking maybe any questions related to anything pertinent, but just kind of establishing a rapport and calming the kid down. And then when the parents get there, it's already easier as opposed to them coming into a volatile situation that you weren't able to assist with prior.
Mm-hmm. Okay. All right. Next question we have here, ladies. I'm sorry, did you want to jump in here? Anyone else?
No, she's just clarifying SRO is a school resource officer.
Thank you, and I apologize I didn't clarify that. Okay. All right, next question here is, how does this toolkit apply to low income and communities of color who have stressed relationships with police?
Okay.
Sounds like you said.
It's the Rene Dominguez show. No.
Okay.
So in New Haven, we are definitely culturally diverse inner city community, and there are perceptions that negative perceptions of the police. So a lot of times, just based on past interactions with the police, every time the police get called, it's something negative. You're responding to a shooting or you're arresting their loved one. And so we have to acknowledge that and recognize that a lot of the time, the anger and the hostility that you might be faced as a police officer is not towards you as the officer. It's just past experiences that the communities that you're working in have had with the police.
But also heightened with what just occurred and the reactions that they're experiencing, those traumatic stress reactions.
Right. So by taking the extra steps, what we're really doing is we're building some foundations to move forward and to realize that police do come to, and we are supportive. We are here to restore order and to help. And you're calling us because there is some chaotic event going on and you need the police. And the more that we could utilize this type of training and this way of handling a situation, the better relationships we're building with the community. It's only going to help us in the future.
Okay. All right. We have another question here. Does Connecticut have a statute that allows enhanced punishment when children are exposed to violence? If so, what are your thoughts on it?
We do not have an enhanced statute for when children are exposed to violence. It's not a greater degree or a greater charge. If we have a risk of injury, we have appropriate charges for a crime, but nothing if children are witness it in an enhancement.
Mm-hmm. Okay. All right. We have one here. How do you address children who are parentifying and help? Okay, let me try this again. So how do you address children who are parentifying and they, I guess the question is like how to help the parent take control and not rely on the child?
That's a good question.
Go ahead.
Can you repeat that? I'm sorry. I don't see it. Can you repeat
yeah. Okay, so I'll read it. So it says, how to address children who are parentifying and help parents take control and not rely on the child.
Okay, well, I think that goes to, some of what we have in the toolkit, which is, and we do see that fairly often, but helping that parent be present, recognizing what's happening and helping that parent be present and pay attention to their child, and not putting that child in the place of answering the questions for the caregiver. I think it also can help, too, that sometimes when parents are having their own traumatic stress reactions that they're not able to feel effective. And some of the things that I think officers can do on scene is remind them sort of that they are the parents and their roles that can help them feel effective and more in that role.
Mm-hmm. Yep. Okay. All right. In your experience, what is the best way to get an entire department trained when there are 3 shifts and days off?
Right now. We're currently doing this. So this is a great time. So we've been doing this type of collaboration with Yale Child Study for 25 years. However, with the development of the toolkit, we're re-rolling out the toolkit to the entire New Haven Police Department, which is about, say, 400 officers right now. Mm-hmm. So 3 shifts, 3 different rotations. We do it in lieu of shifts. It's probably going to take us 15 classes to teach the entire department, to teach the patrol division with some detectives kind of thrown in there, but eventually we'll roll it out to the whole detective bureau as well, and supervisors. So initially I think the focus needs to be patrol, because those are the officers who are out there kind of every day in it and can utilize this the most. And like I said, for us, we do in lieu of shifts. So we switch their shifts, they go to the day shift, and try to do it when there's an overlap of shifts so it costs the least amount of overtime to backfill.
Okay. All right. How do you overcome parental resistance to you reaching out to help the child?
On scene, sometimes, I'm sorry, I'm talking.
No, you're
okay.
On for you.
On scene, sometimes if you bring the parent who is resisting to the side and kind of just have an open conversation as to what it is that you're going to be doing, sometimes when parents don't understand what the objective is, that we don't want to interrogate the child, we're not trying to get information and make that child be a witness. That's never our focus with the children. We don't want to pit the child against one parent, knowing that maybe our caregiver, whoever it is, might have to come back. if we're talking about DV, but even with just in the community where police, they don't want to be maybe seen as a snitch and they don't want their child talking to the police. But if we explain that the child may be affected and that we can just try to give them some tools to be able to calm themselves later, and if we explain everything to the parent exactly what we're going to do, when the best interest of the child is put in front of them, it really breaks down that resistance, and we have a lot of compliance. Not a lot of people don't allow it.
Well, and another thing that's helpful to that is, sometimes there is resistance right on scene, and, the police are there, and because of something really big or negative that just happened, but the officers, they go back and they do follow-ups a lot of the times, and when an officer goes back to the home a few days later and says, I'm just here checking in on you, that also is really helpful in breaking down that resistance.
And that's a huge piece of what we do collaboratively and officers on their own. And that really helps take away those negative views of the police, because we're not coming when it's a negative event. We're just coming back on our own just to say hi. And a lot of these officers work in the same neighborhoods day in and day out, and are able to really establish good relationships.
I would add one thing, too, that I think is very important is that often some of that resistance can come from parents feeling like, oh, there's something wrong with my child, or they're imposing sort of this reaction on them. But by having these toolkits and having the police so informed in terms of how normal and how typical these reactions are, I think that approach can also be helpful to sort of normalize and help parents feel like, okay, this is something that would happen to a lot of kids in this situation.
Okay. All right. Okay, so can you speak to the possibility that some children and families have a history of conflict with police officers and may be re-traumatized by their presence on the scene?
So yes. So, we've seen it before, and, so sometimes police may be a traumatic reminder to something that the child has been through previously or experiences they've had previously, but using the strategies that we're talking about in the toolkit, having the officers serve as protective factors, recognizing that they're responding, that there's traumatic stress reactions happening, and how they respond to those families can really be helpful with that. Yeah, I think what it can often do, and I think there's always going to be those cases where that is a trauma reminder and that might not be able to be replaced, but I think the hope for using some of the skills that we're outlining in the toolkit is that sometimes this can be a replacement, and a new experience with police is actually a very positive one, and at least impact and start to shift how they view police going forward.
That's good. Yeah.
Thank you.
Okay. So let's see here. When it is unclear as to who is the perpetrator and who is the victim, how do you handle finding a safe place for children?
Is this in the so I'm going to assume that this is in a situation with maybe there's going to be a dual arrest and both parents are going to be arrested, or both caregivers are going to be arrested. So our protocol would be to contact our equivalent of Child Protective Services. So let me go back. So we would ask the parents who would be the most next appropriate caregiver, maybe a grandparent, a friend, a close friend, an aunt. We then will call Child Protective Services just to make sure that this person is appropriate caregiver and doesn't have any, open cases or anything, and then we would facilitate that person coming down to the location of the incident, again, making sure the child has everything that they need, and then explaining to the child what is going to happen. Sometimes we'll have that parent explain, just because it's sometimes a little bit easier to know that mommy or daddy or grandma or grandpa, whoever's getting arrested, is okay with this plan. And this was the plan that we came up with together at the police. Makes it a little bit easier sometimes.
Okay. What are we doing to enforce the laws to protect children and enforce those existing? That's all the questions said. I don't know if you ladies need me to repeat that. What are we doing to enforce the laws to protect children and enforce those existing?
So responding to the scene, if like I said, the first officer safety is obviously first, and then determining probable cause. And if there is the probable cause, the officers are, at least in our, in our city, and I'm sure it's everywhere else, that if we're going to charge appropriately and protect the child, and then moving forward beyond just an arrest is what we want to protect the child from further trauma, and making sure they're with an appropriate caregiver, and making sure that their needs are being met if they weren't being met prior. I'm not quite sure if that's answering the question.
I think that's sufficient for now. Unless the rest of you ladies have to chime in with anything else. Okay, we'll just keep going. All right, this next question, this is a really significant tool that has the potential to really rebuild relationships with police. But is it still difficult because police are often trained in tactical muscle memory to neutralize threats quickly? In other words, sometimes the knee-jerk reaction is not to slow down and talk a situation through.
So, like we said a couple of times, I think that an officer safety is always key, and keeping the community safe as well is also one of the first priorities. But there is always time afterwards. We might not think we have the time, but I think if we look at what we're doing after, sometimes we're just standing off to the side, waiting for checks to come back, and if you have a van that picks up the prisoners as opposed to you transporting them, or if you're transporting yourself and you're waiting for another officer to come, there are moments that you can kind of carve out, and the officer, once they realize this and become more aware of it, would be able to engage the child, even if it's just for a couple minutes, even if it's just to make sure that they're settled and they don't have any questions, or to show them your flashlight. Little things like that you don't think are important are super important with regulating the child back, and just calming them down, and just seeing you as someone who came in, as that knight in shining armor, like we want the community to see us as, instead of someone who's just coming in and arresting my dad, because that is ultimately what we might also be doing.
Okay. How do we break the thought that violent arguing around children does not affect them? The perception is that an assault needs to occur.
So I will say that maybe I'm going to let my clinical partners answer, but that might not be maybe an arrest, but it might be something that if an officer, so we might not be making an arrest on a verbal argument, but identifying that children are there, it might still be something that these tools that, that are in the toolkit can be absolutely used with a child at that time.
So if you were to respond to a verbal DV, basically, so you would still talk to them about what effects that they might see, like how this may impact their child, and what effects they might see in their child following this.
Right. Yeah, even if it's not an arrest, because we use this not in all arrest situations. If you think back to the shots fired incident, we're going to be utilizing many of the things that we talked about in that situation, and there is not going to be an arrest that night, probably. You're just responding to gunshots into cars in a house with no arrest. There's no ability to have immediate closure, but we're still going to be addressing the concerns and the how a child is presenting.
I think it's similar to the question of, with the shots fired, of when there is victims who were, we see as a witness also, and when there's witnesses who weren't actually present there when it occurred, but come home to it afterward. It's similar in getting people to really appreciate that those children can have traumatic stress reactions as well.
Okay. All right, we have two more questions here. So does Yale have a definition of a traumatic event? This is to help define for law enforcement at the scene. That's our question.
Sure. So, we refer to events as potentially traumatic events, which can be anything that, the scenarios that the 3 scenarios that we mentioned, but any event that creates loss of control, chaos, fear, is unexpected. Really, if it's a traumatic event, that is if the person, which depends on their characteristics, who they are, their protective factors, if the person develops traumatic stress reactions. So the event can be something small, like 2 people can be in the same car during a car accident. For one, it might become a traumatic event. They might develop traumatic stress reactions, and the other might not develop any reactions at all. So it's really about the reactions that are developed following whatever the event might be.
Okay. All right. And our last one that we have so far that was submitted was, do you have suggestions to protect children during a traumatic situation when only the children speak English and responding officers only speak, maybe that probably, okay, because it says in the responding officers only speak English. Yeah, so let's just say if the children speak, for example, Spanish and the responding officers only speak English. Let's try that. Yeah.
So if there are a lot of times we'll call a Spanish-speaking officer or whatever language, if we have that officer speaking. You obviously, we could use a language line, but some things that even if, and this is not in a situation where we're looking to interview the child, but we're just looking to calm the child down, a lot of times just demonstrating, like if we're trying to do a tactical breathing exercise, which is one of the toolkit, one of the pamphlets, if you are just acting it out, the child will be able to kind of act out with you. If you just get out paper and you just start coloring with the child, there are so many things that you don't realize that you could do, just small gestures that if you can't communicate due to the language barrier, that you could do in that moment just to help the child gain control. But we do try to find an officer who speaks that language or use the language line.
Right. Absolutely. And and there was a clarifying comment that pretty much, I think someone had said that the parents, when they don't speak English, but the child and the officer do speak the language. Yeah.
Really quickly, I'll just touch. We really try not to use the children as interpreters because it causes the child to have to be put in a place where they're now telling on that other parent. And maybe also sometimes the parent doesn't want to give the full account due to maybe a sensitive nature or a violent thing that happened, and they don't want their child to hear that because maybe they didn't actually hear all of it. So we really try to go around and not use children as interpreters unless it's absolutely necessary and time sensitive.
Right. Okay. All right. And so, ladies and gentlemen, so what we're going to do at this point, if you all happen to have any additional questions, please feel free to email us at cev@theiacp. I'll type it in the chat because we will respond to your questions just due to our time. We have about 2 minutes left for our webinar. We'll make sure that we'll respond to you via email if you have any additional questions. So thank you all so much for participating today and for sending these great questions in. But we will definitely continue the conversation offline via email if there are any other comments or questions you have for us. So William, I'm going to turn it over to you to wrap us up.
All right, great. Thank you, Tiffany. I appreciate it. And thank you to our presenters for this wonderful webinar for today. Just a few more announcements before we wrap up. If everyone loves the content that was presented today, then please join us for our next webinar in the IACP webinar series. The next one is Death Notification When Children Are Involved. This webinar will occur June 3rd, 2019 from 1 to 2 p.m. Eastern Time. The registration is here on the screen and located in the webinar PowerPoint that's available in the handouts pod as well. You may contact INTACT through the website displayed on this slide. You can also stay up to date on the latest information by signing up for INTACT's TTA listserv. Also, don't forget to check us out on Facebook. Do you have you can also contact the OJJDP via the help desk by following the contact information on the slide. And do you have a TTA need? If so, please submit a request for help via the OJJDP's TTA 360 platform. through the link displayed on this slide. As a reminder, the webinar recording will be archived on INTAC's YouTube channel, where you can also view past webinars. And for the event script or supporting materials, you can contact the OJJDP TTA Help Desk. Please take a moment to review the disclaimer here. And lastly, we would appreciate it if you could take about 5 minutes to complete the feedback evaluation. Again, thank you all for joining us today. Have a great afternoon. Goodbye.